A lot of people come to couples therapy thinking the main issue is communication, and sometimes it is, but it's usually a bit more complex than that. Couples therapy is often misunderstood in a few pretty predictable ways. So today, I'm going to talk through a few I see most often. I want to acknowledge that I'm going to use couples language, but relationships can take a lot of different forms. Hello, I'm Dan. I'm a clinical psychologist and the director of Lavender Psychology, an LGBTQIA plus affirming and neuroaffirming practice here in Sydney CBD. A lot of people assume that couples therapy is about deciding who's right and who's wrong, or that the therapist will step in and take a side. But couples therapy isn't about taking sides or deciding who's right and who's wrong. The work is focused on understanding what happens between people, especially in moments where things start to feel tense, stuck, or repetitive. And often, both people are making sense from their own perspective. It just doesn't always translate easily to each other in those moments. Another common one is that couples therapy is only for when things are already at breaking point. So people wait until things feel quite severe before reaching out. But in practice, a lot of the work is about patterns that have been building over time, sometimes gradually and sometimes quite quietly. And for many people, there's still a level of care there. It just gets harder to access when those patterns take over. So it's less about how bad things are, and more about whether something feels stuck or hard to shift on your own. Something else I notice is that people think couples therapy is mainly about communication. And of course, communication does matter. Sometimes part of the work is about how people express themselves, or how they listen to each other. But quite often, it goes a bit deeper than that. Because even when people know the right thing to say, they can still find themselves reacting in the same way in the moment. So the work tends to focus on the pattern underneath those interactions. For example, one person might move closer to try and talk things through, while the other pulls back or shuts down. And over time, both people end up reacting to each other's responses. So it becomes less about the words themselves, and more about the cycle that keeps repeating, often despite both people trying. And related to that, conflict often looks quite different on the surface compared to what's underneath it. So it might come across as frustration, or anger, or distance. But quite often, there are more vulnerable experiences underneath that. Things like wanting to feel heard, wanting to feel understood, wanting to feel close, safe, or important to the other person. And those parts don't always come through clearly in the moment, especially when things feel heightened or tense. Part of the work in therapy is about making space for those parts to be seen and responded to a bit differently. Probably the biggest misconception is that one person is the problem, and therapy is there to fix them. Couples therapy isn't about fixing anyone. It's about making sense of what's been happening between people and how each person is experiencing the relationship. And often, both people are trying in their own ways, but getting caught in something that's hard to shift without a bit more support. And just to say, everything we've spoken about here applies across different relationship structures. LGBTQIA plus relationships, non-monogamous relationships, chosen family. And I think that's really important because a lot of advice out there is built on heteronormative assumptions, or a very narrow idea of what a healthy relationship is supposed to look like. And that can leave people feel like they're doing it wrong, when in reality, they're just doing it differently. The same applies for neurodivergent folks as well. The way we experience connection, communication, sensory needs, emotional capacity, all of that can look quite differently. And that does not mean something is missing. It just means we might need different pacing, different structures, or different ways of understanding each other. So rather than trying to force every relationship into the same mold, it becomes more about figuring out what works for you and the people you're connected to. All of that deserves the same care, respect, and understanding. So couples therapy isn't about blame or judgment. It's about understanding patterns and helping people see each other a bit more clearly, and sometimes a bit more gently. And for some people, having a space like that to slow things down can make it easier to reconnect with what matters to them in the relationship. And that's something they might choose to explore with support. If any of this resonates, you're welcome to reach out.